everybody. Happy Friday. Okay, I'm gonna try and make today a kind of short Friday live because I'm sure if you're anything like me, you're probably trying to get outside and enjoy the nice weather. Plus, my neighborhood is having like a neighborhood-wide garage sale this weekend, so we are busy. But I'm gonna try and keep everything upbeat today. We have so much to be thankful for with Fit for Life. It has been another amazing month, record-breaking month for numbers of treatment, which means a higher number of people getting better and a higher number of people in our community served. So this month was also the kickoff of Furniture Warehouse, which we were super excited about, still are super excited about, as it's been just an amazing opportunity, and we will be branching out to other local businesses. So that's all very exciting. A couple of quick announcements about what we're going to be bringing to the table this summer. Hey Margie, I hope you're doing well. So Jenna and I have some really amazing things in the works for Fit for Life for the summer. The first is coming up this next coming week. We will be opening for Fridays. I have decided to switch my schedule around so that we have coverage every day of the week, well, besides the weekend. But I will be now off on Mondays and opening the books for Fridays. So we've had a lot of questions in the past about everybody looking for Friday availability, and that is finally coming to fruition. So if you are looking for Friday appointments or you know somebody who is off on Friday who wants to take advantage of that, we will be doing that starting June 9th. Then the next thing is that coming in August, Jen and I will be starting the certification process for dry needling, which means we will be bringing dry needling to the clinic. We are both so excited because it is really a very beneficial technique for a lot of individuals. So I'm sure we'll be doing a little bit more information on that soon to come as the time gets closer. And then the last thing on the docket, at least for right now, is that in November I will be finishing my Graston certification fully. I will be done with the advanced coursework and the testing, and there will be a lot more that I can do with that treatment technique. So lots of exciting things coming up, but today we wanted to just keep it kind of light and free moving for the nice weekend. So we got a question this past week about, and I do get very passionate about this one, I'll try not to get too soapboxy on everybody, but we got a question this last week from quite a few people actually of what do you think about the massage guns? Do you like them? Are they good to use? Things of that nature. Now, if you don't know what I'm talking about, the massage guns or the vibrating guns, I've seen them go under a bunch of different names, are for sale over the counter. They look like they basically have a handheld piece where you can pull to initiate the action, and then there's a rubber gasket that can pulsate and vibrate and essentially do some level of soft tissue work for your muscles. They are available, like I said, over the counter. Some people have been getting them through their FSA or HSA stores. But the question remains, are they okay to use? Are they beneficial? What are there risks to them? And I'm here to talk about all that today. So kind of right out of the gate, and again, I'll try not to get soapboxy, but right out of the gate, if you are using a piece of equipment or a supplement or a medication and you don't know the answer to are there risks before you are using it, right? That's the kind of question that you want to have answered before you start something. If you're not sure what the answer is, then my answer to you is that you should not be using it at that point in time. I always say to everybody that you want to have the most information that you can have up front. So if you're not sure what the risks versus benefits are or what the actual use is for these massage guns, then please reach out to one of us so that we can get those questions answered for you. I'm going to try and answer some of those today. Now, these massage guns did start off with professional use only. They were being used by athletic trainers, physical therapists, a wide variety of individuals. I think some massage therapists even use them, but once they became more mainstream and got out into the market, I can actually speak firsthand to this. I have family members who work in the emergency room, and they discovered that there was actually more problems arising with them than maybe some people would have thought. So it really breaks down into two parts, and that is that one, if you are not in the medical field, if you have no training in anatomy or physiology, there are actually a lot of structures in the body that you can do more damage to by using such a heavy-duty tissue technique like a massage gun than meets the eye. So you have very superficial nerves, for one, that vibrating and pulsating. If you have a nerve condition, that can irritate it. For two, superficial bones, such as your olecranon or your elbow, the patella, even the spine, how you could feel your spinous processes. Those superficial bones can, I'm not saying that it'll do damage to the bone, but you can certainly create like a bone bruise. You can create tenderness or sensitivity by directing the massage gun to work solely over those bony prominences. And then the third one is that there are structures in the body like your IT band. Everybody knows, I'm sure most people have heard of IT band tightness, but there are structures in the body that unless you're trained to release them, there's actually different ways to release them than by directing soft tissue work over them. So a lot of times what I've seen, the biggest complaint I've seen is, well, I bought the massage gun to release my IT band and it's actually making it worse. The reason being is that your IT band, a lot of people don't know this, but it's not a muscle structure. There is a fanned muscle that attaches to your pelvis at the very top of it, but the actual IT band that runs along the side of your leg and attaches to your knee is nothing but thick tendinous fibers. So that being said, there's nothing to release. You can't, direct the massage gun over that and have it release the actual IT band itself. The way we do that is by going through, and I'm sure a lot of my patients remember me saying, I go through the quads and through the hamstrings. By releasing the muscles around it, you give the IT band more wiggle room to move, and then a lot of those IT band tightness problems do tend to resolve. So, I wouldn't expect anybody to know that unless you're in the medical field, or especially physical therapists, other therapists and massage therapists. But if you are using the gun for that purpose, you can actually do some damage, and you can certainly irritate the condition that you're trying to help. The more serious side to the massage guns, and one of the reasons that I don't like them being over-the-counter use, I won't say I don't like them altogether, because I definitely think that professionals trained to use them can find benefit in them, but I'm talking solely, over-the-counter use. Hi, Sandy. So with that over-the-counter use, you can actually overwork the tissues. And when I say that, most people think, oh, okay, I'm going to make some soreness or some tenderness, but it can actually perseverate and build and get worse than that. So, Jen and I are both manual therapists, and if you've worked with Lindsay yet, Lindsay's obviously a massage therapist, a medical massage therapist. So you know that we are trained with our hands, but a lot of people don't know that we are trained with our hands for years. And a lot of us have also taken extra certifications to do these types of techniques. I myself use Graston when I find it appropriate, but I also sometimes switch to my hands. The reason being is that you can feel more of a response in a trained hand, and you can feel how the tendons, the muscles, the ligaments, the joints are responding to what you're doing. You lose that with something like a massage gun. The massage gun is not giving you any feedback. The muscle is not giving you any feedback. And there are times where we've seen, so a lot of you also know my husband works in the ER. There are times when we've seen cases of a condition called rhabdomyolysis specifically from massage gun use. So rhabdo happens when somebody overworks and overworks and overworks a tissue, specific to muscles most often, and the muscle becomes so inflamed, so overworked, that it actually starts to break down. And the body will start to break down that muscle. the tissue will start to break down, and then you get cells that eat away at that muscle tissue. It becomes a very big problem for a lot of individuals, and it can completely, sometimes it can warrant surgery or become life-altering. So not only are there small, subtle nuances with using something like this over the counter, but there can be big repercussions too. I'm not going to sit here and say that that's all the time. Again, certainly, when you're trained, you can use these. If you're seeing a professional who's trained in it, they can absolutely use it. And there is a lot of benefit to it, but I don't ever really encourage anybody to just go purchase one over the counter and try to figure it out on their own. Okay? So that is a very broad way to answer that question. I know it probably gave you some more questions regarding the use of the massage guns, and there's certainly other equipment being sold over the counter, TENS units and therapeutic exercise bands and things like that. We can answer all of your questions about this equipment before you go out and buy it. So if you're on the fence about something that you feel like might be beneficial for you or the condition that you're seeing us for, or if you have a friend or a family member, please, I encourage you to reach out to us. Ask us your questions. We can get you to the point where you feel like you understand what the benefits are, understand what the risks are. And if we do determine it's something that would be good for you, then we can coach you through using it. Okay? So that's all I have for this Friday. I hope everybody enjoys this beautiful, beautiful weekend. Please mark your calendars for all of those things that I was talking about coming to Fit for Life, and we will see you in the office.